Hello everyone, welcome to the Umer interview. And it's a very honor to have Professor Sadick to join us in participating in this Umer interview. According to the WCHR 2026, and we are lovely to have you to introduce yourself to the Chinese audience. Thank you.
Well, it's a pleasure to be here. I'm Dr. Neil Sadick. I practice in New York and are head of the Sadick Research Group in New York, and I hold dual professorships at Cornell University and at the University of Minnesota, where I'm an adjunct professor. So a lot of our research has been on the diagnosis and new treatment modalities for hair loss, and that will be the essence of this interview today.
Okay, thank you very much. Today we are talking about the non-ablative laser therapy for the androgenetic alopecia. And the first one question is, compared with ablative lasers, what are the differences and advantages of non-ablative laser in treating AGA?
Well, the advantages of non-ablative lasers are that there's no post-operative care, really. There's no downtime at all. There's no potential for scarring, and the results are quite excellent with the new generation technologies that our research group has pioneered.
Okay, thank you very much. And what is current clinical efficacy and overall patient acceptance?
Well, there's excellent clinical efficacy, as in 3 publications our research group has performed, and they continue to evolve the treatment successes using, again, the non-ablative laser for treatment of androgenetic alopecia. Patient acceptance is very high. We have something called PRP, pain or discomfort, that many people have, and again, the laser for treatment of hair loss is an alternative that has much less discomfort associated with it.
Thank you. And how do you think physicians can select appropriate wavelengths of non-ablative lasers based on individual patient conditions such as skin type, alopecia severity, and hair follicle status to optimize therapeutic outcomes?
Well, actually, we've been able to delineate the optimal wavelength, such as 1565 in the Folix laser by Luminous, which has been shown the only laser approved by the FDA to be able to stimulate hair growth. And in our long-term usage of well over 500 patients, we've had no significant side effects, very little discomfort. There's a little bit of discomfort, but very little, and excellent treatment results that have been published in multiple peer-reviewed journals.
Okay. And besides, what specific post-operative care guidance would you recommend to patients?
Well, there's very little post-operative care, which is great. Patients can come in on their lunchtime from work. They have the treatment. They go back to work. They can go to the gym. So there's really no significant post-operative care that's necessary.
Okay. And looking ahead, what cutting-edge research findings on action mechanisms in this field are expected to achieve clinical translation and further improve treatment efficacy?
Well, right now we're looking at the role of inflammation as a major cause of hair loss, microinflammation leading to microfibrosis. So if we can improve, again, the inflammatory component of hair loss using laser technologies such as Folix, and also stimulate the hair stem cells, those are 2, again, very positive outcomes that can achieve in what I call tricho-health and potential for hair regrowth in all individuals.
Okay. Do you have any suggestions to the Chinese audience to doing this non-ablative laser therapy to the AGA?
Well, I came to China to introduce the laser for treatment of androgenetic alopecia, and it's now well accepted there. So if you have a practice where you treat a lot of patients with hair loss, it's really an important part of your therapeutic armamentarium. So if you're going to have a good hair practice, again, utilization of technologies such as PRP, low energy light or photomodulation, and the non-ablative laser such as the Folix are important parts of that treatment protocol.
Okay. Thank you very much to share your insight, and thank you again to join the Umer interview. Thank you.
It's a pleasure to be here.
Okay. Bye.